Inflammatory arthritis can be a real pain, literally and metaphorically. Today I'm breaking down the main types of inflammatory arthritis, so you can better understand what's going on inside your body. First up, rheumatoid arthritis, or RA. This one typically starts between 30 to 60 years old and is more common in women. RA causes joint pain, swelling and stiffness, especially in the mornings. It's an autoimmune disorder, meaning your body's immune system mistakenly attacks your joints. Keep an eye out for joint deformities and cardiovascular complications. Next, psoriatic arthritis. This often hits between 30 to 50 years old and affects both men and women equally. Joint pain and skin plaques are the major symptoms to watch for. It's linked to psoriasis and can lead to joint damage and disability if untreated. Ankylosing spondylitis usually starts in early adulthood and is more common in men. Look for back pain, stiffness and fatigue. It's a chronic condition affecting the spine and sacroiliac joints, which can lead to severe spinal deformities. Reactive arthritis, also known as Reiter's syndrome, often follows an infection and is more common in men. Expect joint pain, eye inflammation and urinary symptoms. While it can go into remission, it can also cause chronic joint problems. Got gout or pseudo-gout? These fall under crystal-induced arthritis. Common in middle-aged adults, especially men, these conditions are triggered by diet and dehydration. Acute joint pain and swelling are the telltale signs. Palindromic rheumatism hits younger adults and can resolve spontaneously. Episodes of joint pain and swelling are common, and it might progress to chronic arthritis. Behçet's disease typically strikes in your 20s to 30s and affects both genders equally. Oral and genital ulcers, eye inflammation and joint pain are key symptoms. It's an autoimmune disorder with unknown triggers. Polymyalgia. Rheumatica usually affects those over 50 and is more common in women. Think shoulder and hip pain with morning stiffness. It's an autoimmune-related condition. Relapsing polychondritis affects cartilage, causing inflammation in the ears, nose and joints. It can also lead to respiratory issues. Polymyositis and dermatomyositis affect muscles and skin, causing muscle weakness and skin rashes. More common in women, these can impact muscle function and lung health. Mixed connective tissue disease combines features of lupus, scleroderma and polymyositis. It primarily affects women and can lead to organ involvement and Raynaud's phenomenon. Undifferentiated connective tissue disease has variable symptoms and can evolve into specific autoimmune disorders like lupus or scleroderma. Granulomatosis with polyangiitis affects small blood vessels, primarily targeting the kidneys and respiratory system. It's more common in men and can lead to kidney failure without treatment. Microscopic polyangiitis also impacts small blood vessels, leading to kidney and lung issues. It affects both genders equally. Eosinophilic granulomatosis with polyangiitis impacts the respiratory and cardiovascular systems. Asthma and peripheral neuropathy are major symptoms. Juvenile dermatomyositis affects children and adolescents, causing muscle weakness and skin rashes. Systemic juvenile idiopathic arthritis starts in childhood, causing fever, rash, and joint swelling. It's crucial to manage the systemic inflammation. Finally, adult-onset Still's disease typically starts in young adulthood. Look for fever, rash, and joint pain. By understanding these conditions and their symptoms, you can take proactive steps to manage your health and improve your quality of life. Stay informed and stay strong.